Well, the ER staff eat Primanti sandwiches and their patients wear Steelers jerseys. About to launch its second season, the hit HBO Max show The Pitt gives national viewers an accurate slice of life here in Pittsburgh.
But it's also a compelling look at the lives of healthcare workers on the front lines, modeled after the emergency department at Allegheny General Hospital. New at 5, Andy Sheehan asked the real-life leader of that department how The Pitt stacks up with reality.
I tell myself that every day.
In The Pitt, actor Noah Wiley plays the compassionate and increasingly world-weary Dr. Robbie, who contends with the daily onslaught of injury and trauma at a hyperactive Pittsburgh trauma center based on the one at AGH. Do you hop from bay to bay and,
yes,
and oversee things?
Absolutely, yes.
Yeah. Meet his real-life counterpart. Dr. Brent Rao is emergency medical director at AGH, now known to his staff as Dr. Rowby, who, like the Wiley character, supervises an ER staff, though a typical day here is not quite as action-packed.
I have seen all of those cases and most of those situations that they had in that first season during my career. Not all in one shift, though. You know, that's a bad shift.
Still, Rao not only gives the show high marks for medical accuracy in diagnosis and treatment, but its focus on the emotional toll on the nurses and attendant physicians and how healthcare workers deal with what they see on a daily basis.
Just being in this place day in and day out with this level of sick patients and the suffering that you see, it's very difficult to not kind of internalize some of it and need that decompression afterwards, and to need that, you know, the ability to reach out and to talk to colleagues going through it and to reach out to other sources.
But after 15 years in emergency medicine, contending with death, suffering, and tragedy is still a work in progress for Rao. Like Dr. Robbie, he has had to tell parents that their son or daughter has died. And oftentimes he and his staff need to shut down emotionally just to focus on their job. But as a husband and father of two, he can't quite process the pain of children in trauma.
There is no hardening to that. There is no getting used to that. There's really not getting used to any of this, but there are some things that hit particularly hard, and I think myself and most of my staff would agree that the kids are definitely very difficult.
As the leader here, he is not only in charge of the patient's care, but the well-being of his staff as well. Healthcare workers may dip into depression and substance abuse, and Rao seeks to counter that by debriefing his staff after tragedy and encouraging them to reach out to one another.
We are professionals, but unfortunately it does kind of wear on people, and you need to kind of have each other's backs, and we do a really good job here, I think, at Allegheny General, having each other's backs in this emergency department.
Art imitates life and life imitates art. Dr. Rao and Wiley have become friends in their separate roles, and the staff here has weighed in as consultants, telling the actors and the producers what it's like to be on the front lines of human suffering and the price they pay for it. Reporting at Allegheny General Hospital, Andy Sheehan, KDKA-TV News.